Imagine walking into a modern hospital. There are robots assisting with surgeries, AI helping diagnose diseases, and advanced imaging technology revealing what's happening inside the human body. Then you notice something strange. A doctor pulls out a clipboard and starts writing notes with a pen. Today in Factonetic channel, we discuss why hospitals still use papers. We're living in an era where technology has transformed almost everything. Your watch can monitor your health, your car can drive itself, and your watch tracks your heartbeat. But hospitals are still using paper. There's actually an interesting explanation for this. Think back to how hospitals used to operate. For decades, everything ran on paper. Medical records, prescriptions, lab results, all handwritten or typed and stored in enormous filing systems. A patient's entire medical history existed as a physical folder in a record room. When digital technology became widespread, the healthcare industry saw an obvious solution. Electronic systems would make everything faster, more organized, and more accessible. It seemed inevitable that paper would disappear. But that transformation never fully happened. Instead, most hospitals today operate in a hybrid state. Some records are digital, others remain on paper. Doctors enter information into computers while also jotting notes on charts. Documents get printed, signed, scanned, and stored. This creates a system that somehow carries the burden of both approaches. So what's preventing the complete digital transition? The answer involves three interconnected factors. Understanding each of these reveals why this problem is harder to solve than it appears. Start with the technical challenges. Electronic health record systems, EHRs, were designed to streamline medical documentation. But there's a main problem. Different hospitals use different EHR platforms, and these systems often can't communicate with each other. When patient records need to transfer between facilities, the incompatibility becomes a real issue. The systems can't properly share information, so hospitals resort to an older solution. They print the records and fax them. Fax machines remain standard equipment in hospitals specifically because they provide a reliable way to transfer information when digital systems fail to connect. Then consider system reliability. Digital networks experience outages, computers crash, and cyber attacks on healthcare facilities have become increasingly common. During these disruptions, medical staff need immediate access to patient information. Paper serves as a crucial backup system. It doesn't depend on electricity, internet connectivity, or functioning servers. In emergency situations, this reliability can be the difference between effective care and dangerous delays. Now consider the human factors. Healthcare professionals have built their expertise around established workflows. Transitioning to digital systems means retraining entire teams while they continue providing patient care. This creates pressure that can't be ignored. Many clinicians find that current EHR systems actually slow them down. The interfaces require multiple steps to access basic information. During time-sensitive situations, some doctors find handwritten notes more efficient than navigating through complex digital menus. Screen fatigue is another real concern. Medical staff already spend substantial time on computers for documentation, orders, and communication. Increasing that screen time affects their ability to engage directly with patients and can lead to burnout. Research has documented that medical errors can temporarily rise when hospitals implement new EHR systems. Staff are learning unfamiliar technology while maintaining patient safety, and that transition period carries risks. This isn't a minor concern when we're discussing medication dosages and treatment decisions. Finally, there are legal and regulatory requirements. Medical documentation must be preserved for years and needs to be legally defensible. Patient consent forms require signatures, and paper makes this straightforward. Digital signatures involve verification systems, security protocols, and legal frameworks that vary across different jurisdictions. The legal system itself is built around physical documentation. Courts understand paper trails. Digital records require proof that they haven't been tampered with: encryption, access logs, audit trails. These security measures are necessary but add layers of complexity and cost. Privacy regulations create additional demands. A locked room with paper files is inherently secure in a simple, understandable way. Digital systems require constant monitoring, encryption, breach detection, and compliance verification. Building and maintaining that infrastructure requires significant ongoing investment. Here's what makes this interesting. Some healthcare systems have successfully made the leap. Hospitals in countries like Singapore, South Korea, and parts of Scandinavia have gone almost entirely paperless. They've made major investments in integrated technology, comprehensive training programs, and redesigned workflows. The transformation is possible. So the question isn't really about whether hospitals can eliminate paper. It's about whether healthcare systems are willing to make the substantial investments needed in infrastructure, training, and transition time to make it work properly, and whether we are prepared to manage the risks that come with any major operational change. Until those investments become a priority, paper will continue to coexist with cutting-edge medical technology. What's your perspective on this? Should the healthcare industry be pushed toward complete digitalization, or does paper still serve a legitimate purpose in modern medicine? Share your thoughts below. Subscribe the Factonetic channel for more interesting facts break down into simple steps.